What would you do if you suddenly experienced numbness in your face while alone at home? Would you be able to identify the signs of a stroke if it occurred unexpectedly? And would you know the critical steps to take in those first precious minutes when no one is there to help? Unfortunately, strokes don't choose a place or time. They can happen at work, in your car, at the grocery store, while walking, or even in your own home. In this video, we'll share with you the 5 life-saving actions that could make a big difference when you're facing a stroke alone. You'll discover the surprising symptoms most people miss until it's too late. Why your smartphone might be your most powerful lifeline. The counterintuitive position that could keep you alive while waiting for help, and a simple technique emergency doctors wish everyone knew. Every 40 seconds, someone in America has a stroke. A stroke is a race against time. When blood flow to the brain is interrupted, brain cells begin dying within minutes. Most stroke advice assumes someone else is there to help, to call emergency services, or drive you to a hospital. But what if you're alone? The reality is many people live alone, especially older adults who face higher stroke risks. Understanding how to recognize and respond to a stroke when no one is around could save your life. Have you ever had a stroke while alone? What measures did you take? Leave your comment below. Now, let's look at the 5 critical steps that could save your life when minutes matter most. 1. Recognize the symptoms immediately. The first and most crucial step to surviving a stroke alone is recognizing that you're having one. This is harder than it sounds. Strokes can muddle your thinking, and denial is a common first response. Your brain might try to explain away symptoms as something less serious. The medical community uses the FAST acronym, face, arm, speech, time, to help identify strokes. When alone, you need to perform these checks on yourself. Face. Look in a mirror or use your phone's camera. Try to smile. Does one side of your face droop? Arms. Raise both arms in front of you. Close your eyes and try to hold them steady for 5 seconds. Does one arm drift downward? Speech. Say a simple sentence aloud like, "The sky is blue today." Are your words slurred or garbled? Can you form the sentence correctly? Time. If you notice any of these symptoms, time is critical. Every minute counts. Beyond fast, watch for these other warning signs. Sudden numbness or weakness, especially on one side, sudden confusion or trouble understanding, sudden vision problems in one or both eyes, sudden dizziness, loss of balance, or coordination problems, sudden severe headache with no known cause. The difference between recognizing these symptoms and dismissing them could determine whether you reach help in time. Don't wait to see if symptoms improve. Strokes rarely get better without treatment, and delaying action only increases brain damage. 2. Call emergency services immediately. Once you recognize stroke symptoms, your priority is getting emergency medical help as quickly as possible. This step sounds obvious but becomes complicated when you're experiencing a stroke. Call emergency services 911 in the U.S. immediately. Even if your speech is affected, dispatchers are trained to recognize stroke symptoms. Say stroke if you can, but even if you can't speak clearly, stay on the line. Many emergency systems can trace your location if you can't communicate it. If you can't reach a phone or dial, consider alternative communication methods. Use voice commands on smartphones, "Hey Siri" or "OK Google." Call 911. Press emergency buttons on smartphones, rapidly pressing the power button several times on many devices. Use medical alert devices if you have them. Use smart speakers if available. Alexa, call for help. Bang on walls or floors if you live in an apartment or connected housing. When connected with emergency services, communicate as clearly as possible. State that you think you're having a stroke. Give your location. Mention if your door is locked. Responders may need to break in. Describe your symptoms and when they started. The hospital choice matters significantly for stroke outcomes. If possible, request transportation to a designated stroke center. These specialized facilities have protocols and equipment specifically for treating strokes quickly. Some ambulance services can bypass closer hospitals to reach stroke centers if the situation warrants it. 3. Make yourself accessible to help. After calling emergency services, your next task is ensuring help can reach you when they arrive. This step is often overlooked but can prevent critical delays. First, unlock your door if possible. Emergency responders may need to break down locked doors, wasting precious minutes. If you live in a security building with multiple entry points, try to move toward the main entrance if you can safely do so. If you're in a remote area or somewhere not easily visible from the street, find ways to make your location obvious. Turn on outside lights, open blinds or curtains. Position yourself where first responders might look, near the front door or in a main room. Next, gather essential information for paramedics. If possible, collect a list of your current medications, your medical history, especially conditions like high blood pressure or previous strokes, contact information for your doctor and emergency contacts. Create a safe environment while waiting. Clear a path to your location. Move furniture or objects that might block medical equipment. Turn off stoves or other potentially dangerous appliances if you notice symptoms while cooking. If you have pets, secure them in another room if possible. This prevents them from interfering with emergency responders. These preparations might seem secondary when you're experiencing stroke symptoms, but they can significantly reduce delays in receiving treatment once help arrives. 4. Position yourself safely while waiting. How you position yourself while waiting for emergency services can affect your condition. The goal is to minimize complications and prevent further injury. If you're experiencing weakness or dizziness, common stroke symptoms, lie down on your side rather than remaining standing or sitting. This reduces the risk of falling and further injury. The recovery position, lying on your side with your top leg bent and bottom arm supporting your head, is ideal as it helps keep airways clear. Keep your head slightly elevated if possible. A small pillow or cushion can help. This position may reduce pressure in the brain for some types of strokes. Avoid eating or drinking anything while waiting. Strokes can affect your ability to swallow properly, creating a choking risk. Additionally, some stroke treatments can't be administered if you've recently eaten. Remove constricting clothing like tight collars or belts that might affect your breathing or circulation. Loosen anything around your neck, chest, or waist. Try to stay warm without overheating. Stroke can affect your body's temperature regulation, and excessive cold or heat can place additional stress on your system. Most importantly, remain as calm as possible. While this is easier said than done, stress and panic can raise blood pressure and potentially worsen stroke damage. Focus on breathing slowly and steadily while waiting for help. Before we continue, I've got some exciting news to share. If you enjoy our content and want access to exclusive benefits, become a channel member. As a member, you will unlock some amazing perks like early access to new videos, priority replies to your comments, members-only shorts, polls, quizzes, and special emojis and loyalty badges just for you. Just click the join button and be part of this community that values health and well-being. Your support helps us keep bringing high-quality content for you. 5. Document your symptoms and their progression. While waiting for emergency services, documenting when your symptoms began and how they're changing can provide valuable information to medical providers. The exact time your symptoms started is one of the most critical pieces of information doctors need. Certain effective stroke treatments must be administered within specific time windows from symptom onset. If you can note the exact time you first noticed symptoms, this information could determine your treatment options. If possible, use your phone to record the exact time symptoms began, which symptoms you experienced first, how symptoms have progressed or changed, any actions you've taken, medications, position changes. If writing or typing is difficult, consider using your phone's voice recording feature to verbally track this information. Beyond timing, pay attention to whether symptoms are getting worse, staying the same, or rarely improving. This progression information helps doctors understand what's happening in your brain. Also note if you've taken any medications recently, especially blood thinners, pain relievers, or blood pressure medications. This information affects treatment decisions at the hospital. If your condition allows and you have the presence of mind, set an alarm on your phone to go off every few minutes. This can help prevent losing consciousness without anyone noticing and serves as a backup in case you become unable to call for help again. The specific details you document during this emergency can significantly influence your treatment plan once you reach medical care. Surviving a stroke alone doesn't end when emergency services arrive. What happens at the hospital and in the weeks following determines your long-term outcome. Once at the hospital, stroke treatment focuses on restoring blood flow to your brain as quickly as possible. For ischemic strokes caused by blood clots, treatments might include clot-dissolving drugs like TPA or mechanical clot removal. These interventions are most effective when administered within hours of symptom onset, which is why recognizing symptoms and getting help quickly is crucial. Recovery continues long after the initial emergency. Physical therapy, speech therapy, and occupational therapy may be needed to regain functions affected by the stroke. The brain has remarkable plasticity, and with proper rehabilitation, many stroke survivors regain significant function. The best way to survive a stroke is to prevent having one. Managing risk factors like high blood pressure, high cholesterol, diabetes, smoking, and excessive alcohol consumption significantly reduces stroke risk. Regular checkups can identify these risk factors before they lead to emergencies. For those at high risk or who live alone, consider preventative measures. Regular check-in systems with friends or family, medical alert devices, smart home technologies that can detect unusual patterns, stroke risk assessment with your doctor. Time is the most critical factor in stroke survival and recovery. Each preparatory step you take before an emergency and each minute saved during one translates directly to preserved brain function. By knowing how to recognize and respond to a stroke when alone, you give yourself the best possible chance of not just surviving, but recovering well. Now we want to hear from you. Were you already familiar with these steps? Do you have any other advice or experiences to share? Leave your comment below and help others be better prepared. Information saves lives. If you found this video helpful, please type yes in the comments below. I also encourage you to check out these two videos we selected especially for you. Thanks for watching.